All right. Hi, everyone. Thank you all for staying. My name is Howie. I'm a postdoc research scientist in the Department of Environmental Health Sciences and Maryland School of Public Health. And it's my pleasure to introduce you guys today the Columbia COVID-19 Hub, which you can find on that link. I'm going to give you guys a brief overview of what the hub is and how it came to be. And then Maneesha and Kriste are going to take you guys through a live demonstration of how the hub works. Okay. All right. So following the shutdown, there was this incredible upswell of research, volunteer, and other efforts related to COVID-19 around Columbia University. A lot of these efforts were, small groups of people getting together and having this great idea and then going out and making them happen. But because of that, it's also decentralized. There's no central organization that oversees all these people and collect their data, right? Everybody is doing their own thing, and they're doing some really amazing things. And by mid to late March, there was this effort from a lot of different groups in order to understand all the efforts that are going on around Columbia University, right? All these offices and organizations are collecting data on their own people for their own purposes, right? So there are established organizations like the Engineering School and Maryland School of Public Health collecting information on their faculty, volunteer organizations such as CSSC and CRAC, as well as individual efforts such as Dr. Green and Califano are collecting data on all the research that's going on around Columbia. Again, related to COVID-19. And suddenly this situation erupted in late March and early April, where it was very apparent that there were a lot of redundant efforts, or at least overlapping efforts, right? A lot of research there were a lot of very similar research where people are doing very similar things. And we thought that it would be more helpful for them to know what each other are doing and sort of work together rather than work on overlapping ideas. And as you can imagine, because there are so many of these efforts to collect data on the projects, on the volunteers, there was a lot of redundancy in the data collection process itself, right? If you're someone doing research on this, you're getting survey requests from a bunch of different people, fulfilling their needs, but not each other's needs, right? So again, what I want to paint in the picture is that by early April, there was this need for a central resource and an essential database where all this information is collected and stored in one place, and people who can and need to access it can get it from one single place rather than to get it from their individual sources. So at this point, the Office of Executive Vice President for Research put together a team of CRAC volunteers, a team from CUIT, and the Data Science Institute to sort of build and maintain this database, which is what I'm talking to you guys about today. And all of this is overseen by the Research Leadership Coordination Committee, and you heard from the chair earlier today, Dr. Shalansky. But what I want you to know is that this committee leading this effort comprises representatives from all different schools and organizations around Columbia, right? It's not just a CUIMC initiative. It's not just the Zuckerman Institute, and it's not just the graduate school. It's all the different schools and organizations affiliated with Columbia. So this really is a sort of a Columbia-wide effort to collect data and store them and present them in one single place. Also, please allow me to take this time and do the acknowledgements now instead of at the end. I want to acknowledge that all of this has been a combined effort from a lot of different people, from CRAC volunteers, CUIT, and all these people listed here, especially within the committee, Dr. Jeanette Wang. All right, so again, the goal of this hub is to provide information so that it satisfies all the different needs and areas that we think it needs to address, right? So first, it needs to be an information source. It needs to be an information source accessible by many different people for whatever reason. Even if you're just, someone who's curious about what kind of research that Columbia is doing. If you want to find the clinical trials on chloroquine and all this other stuff, anything that you can imagine, well, we want you to be able to find it in a searchable database. So it's fulfilling that role. If you're a volunteer who's interested in working on something related to COVID-19 to help out in any way, this database also allow you to look through the projects that match your interest and skill set and also are asking for volunteers. Similarly, if you're someone who's working on a project, but you need collaborators with particular expertise, well, this data hub is, again, a way for you to identify potential collaborations and at the same time, reduce redundancies, right? You can see what each other are working on and, again, work together rather than overlapping and doing a lot of the same things. Of course, we're also then collecting information for administrative uses, as well as, for example, to identify commercial opportunities with the CTV office. And at the end of it all, a lot of this information is protected through union access. But we're also going to build an externally facing public website with some of the information just to broadcast what Columbia is doing. Okay, so this data hub is currently taking input from a couple different surveys that are open to basically anybody who are working on COVID-19 research. The project intake form is to be filled out by the lead investigator of any particular project. Again, it doesn't have to be research, it can be research, engineering, volunteer, whatever. And it, again, ask for very basic information such as the title for the project, key personnel, description, things like that. And then there's a separate investigator intake form which asks for basic information about the person taking it, you know, title, department, things like that. All of this stuff are necessary information and information that we sort of went around asking different offices and see what they needed. So it really is just like this, we imagine this to be like the last survey that you have to take, right? Like they're supposed to collect all the information that everybody needs. And I want to also make a note that every single detail matters. Maneesha and Kriste are going to get into this in just a minute, but that's how the search function works. So like as much information as you're comfortable providing, knowing that every detail matters for searching and visibility. I also want to take this time and tell you guys that improvements are coming. We're constantly working on new designs and new features, such as filters to help the user experience and the overall design. We're constantly working on cleaning the data and adding more data. And again, as you guys are going off and using this database, we want your feedback as well. There's a links in that database for you guys to give us feedback. And we would really like to hear from you guys about anything we could do better. Okay, so before we get to the demonstration, I want to take this moment and sort of ask something from you guys. So right now, we have 250 projects and over 400 investigators. And again, we're constantly updating this to include more information. But we also know for a fact that there are a lot of projects and investigators that are not currently captured by our database. Like we recognize that. So this is where we need your help, right? This database only works if everybody is willing to contribute information in some capacity, right? If you're working on research, we would like to ask you to consider putting that information in, right? If you're working on COVID-19 research, but you're not the lead PI, well, we would like to ask you guys to go on the hub, look for the project, and if it's not there, consider asking the lead PI, whoever it is, whether it's your boss or if it's a collaborator, to consider putting that information in, right? So we really, in this sense, really need sort of community engagement and buy-in and provide us with the data. And the more data we receive, the better all this is going to work. Okay, so without any further ado, I'm going to pass this off to Maneesha, who's going to give you guys first look at the database, which you can access yourself.
Thank you, Howie. Hello, everyone. I'm going to just share my screen in a minute. I'm hoping you can see it. This is the landing page, which Howie just mentioned. I will post the URL also in the chat right after this. This is the EPPR site. It talks about COVID. You can see the two surveys Howie was mentioning, the investigator survey and the project survey. The links are right here, so you can fill the information here. Any feedback or improvements, etc., or ideas that you might have here, here's a link to the mail too, and you can send those things here. To get started, this hub is available behind the Uni authentication. When I click on it, standard Uni and password thing will pop up. What I've done is I've already logged myself in, and this is the landing page of the COVID hub. You will notice on the very top is Google-like search, which is very powerful. You can search for phrases, words, names, projects, etc. And I'm going to leave it to my colleague Kriste to really talk about that, but I'm going to show you functionality of this project. On the very top, as you also notice, there is the link again to the project page, as well as your PI page. You can add your information. It links to the same Qualtrics form, which is collecting the information. So as I go down, this site is divided into three main areas. One is browse projects, browse people, and browse areas of expertise. On the browse projects, you see there are 257 projects that are here. The data is updated multiple times in a day as soon as it's collected, just with a few hours of delay after cleaning is done. You can go down the list and look at all these projects if you want. It's a listing showing you the title. These are all clickable, or you can see there is a breakdown of this also available here. Similarly, when you look at the browse people, there are over 400 people whose information is available here. Again, you can go down the list, look for the people, or you can search in the alphabetical manner. Browse areas of expertise is about areas which people are concentrating and working on, and there are over 800 areas of expertise. Again, you're the same format, you can look at this. Let me just pick this one sample from here. I'll take air quality and run. When I click on air quality, essentially it does a search. You'll see the search bar fill in air quality, and it now brings up a search of air quality. There are 16 projects and 35 people in this area. You can go down and take a look at them. There is project title on the left, project description. If the project description is larger, you can show more and show less. So you can read through the project description, and it's the name of the principal investigator. You can see all these 16 projects on this singular page. Let me click on, same thing with people. If I click on people, you'll see there are 35 people who are listed. Their names are listed, your contact information, and which school and department they are from. They're also sortable. So if I sorted them out, you'll see, there are these 2 people who are from bioinformatics who are related in some shape or form with air quality. Let me go back to the projects, and let me first walk you through the projects. So here's an example of a project. When I click on a project title, it takes me to the project detail page, where again, you'll see the title, you'll see lead principal investigator, co-investigators if there are any, external collaborators, external institutions, and a project description that you saw before. There are also some other information that is available about lead organization, led by, the status of the project. Again, here, Howie was mentioning about volunteers. Now this is an area where you can see volunteers are needed and the areas of which volunteers are needed. If this project has any public data available, there'll be a link to that. This one doesn't, and publications that might be here. So each project has a page much similar to this. The link to principal investigator is highlighted. I can click on this and I can look at the people page, or every investigator who has people information, which is 400+ users, has a page like this. Person has a title, department, their email address, if there's website available, there is a bio of the person, publication, and advisory panel, if there are any, their areas of expertise, and all the projects that they are associated with. So you can see there are these projects that are associated with. The areas of expertise are clickable. So if I click on any one of them, I'm able to, again, execute a search. And this time I'm executing a search with clinical trial, which shows me there are 45 projects and 119 people who are working on it. So same way, this is the list of that. And I can click on any person here and then go through their profile. Their profile, just to show you an example again, this is email. This person has a website information that's available here, their bio, if there is publication, and the projects that they may be working on. At the very bottom of this page, there is also questions, comments, and feedback, just as Howie was saying. If you have ideas on how to make it richer or have questions or suggestions and improvements, then please do send your information to us. Let's go back to the clinical trials. Again, the landing page is COVID Hub 19. You can search by or you can browse by. I'm going to just hand it over to Kriste to talk in detail about the search capabilities. But let me show you in a minute the next thing we're talking about, which is the design, which fit filters. So here's a design element. This is being worked on. This will be the landing page, Google-like search. You can expand to do your browse by, or let me search. When I search, I get a new page, or a page which is slightly different design. You can look at all projects and people. When you have projects.
Maneesha, you're at the 1 minute mark.
Oh, okay, I'm gonna go very quickly. I wanted to show the filtering capabilities. The filtering capabilities allow people to search to say, within the HIV, I'm looking for volunteer opportunities. So this is something that is coming very soon. And with that, I'm going to pass it on to Kriste to talk in detail, to talk about the search capabilities.
Thank you, Maneesha and Howie. Given the amount of time that I have left, I don't know how much time I have left, and there's a little bit of echo there. So I would just like to highlight some of the advanced features that DSI worked with CUIT to implement in this hub. I'm going to start with pointing out that if you would like to do a search of an exact phrase, you can use quotes. In this case, I would like to search for entries that contain the term or the phrase immune response. Also, in many instances, when you're unsure of a word spelling, you could put tilde at the end of the word. Let's say I would like to search for entries that contain the term pheroptosis, but not being from the medical field, I may have problems spelling that name. I've put tilde to the end of the word, which I believe is the proper spelling of pheroptosis. So this would correct for that spelling. So this is also known as fuzzy search, and it returns results that contain terms similar in spelling to the search term. Another advanced search feature is that if you can actually search for a much wider term variation, and you can do that by adding the wildcard character at the end of the term. In this case, I'm searching for any terms that start with the phrase immune. And as you can see, it will actually match with different variations of immune. Lastly, I want to talk about how you can use Boolean search operators to perform a more advanced search. And so what these Boolean search operators allow you to do is you can combine multiple terms using the AND, NOT, or OR operators. So let me give you an example. So let's say you would like to search or retrieve entries that must contain the term infection, but immunity is optional. So in this case, what I'll do is I'll put the plus symbol in front of infection and I'll leave immunity as it is. And so you can play with this. In this case, what we'll obtain is entries again that need to contain infection, but immunity may or may not be there. As I mentioned, another Boolean search operator that you can use is the NOT operator or the minus symbol. So let's say you would like to search for terms that need to include the immunity, but infection shouldn't be there, or you would like to exclude that term. So in this case, I'm just going to place minus in front of infection. Lastly, I want to point out that a summary of these advanced search features are provided under search terms, if you follow the search terms link. And I would like to also point out what Howie mentioned at the beginning is that in the next version of the hub, we plan to implement a search feature that would allow you to search for terms or phrases in a particular field. And here under the search tips, we've actually listed the fields under which you can perform such a search.
Kriste, in the interest of time, since we're near the end, maybe it's time to take some questions.
Sure, yes. I left it for you to organize that.
I noticed that there was a question put in the Q&A box, but it seems to have disappeared. And that question was, is there any plan or way to get access to this information if you do not have a Columbia uni? And I think I know the answer, but is there a plan to broaden this at all, to increase the possibility of collaborations, say, within the Northeast?
So I think I was the one who answered that question and made it go away. So I think right now there are no concrete plans to expand this to allow no uni access. We do have an externally facing public website also pulling data from this. So there's already going to be a large component of that is publicly available without uni access. All the other information that are behind uni access, we want to encourage within Columbia collaborations, I think, and we certainly don't want to discourage collaborations with external institutions, but it's just not really what the database is built for.
Right. I see that Marty Chalfie has a question.
I looked on the website just now and I did a quick search and I could not find really anything related to human rights. And there must be research that people are doing in terms of the many human rights consequences of this pandemic. Are those just not part of this database, or you haven't been able to connect with people about this?
Maneesha, you want to go, or I can do? Meanwhile, actually, I did search for human rights, and there is one person that was listed. I'm sharing the screen to show you the results.
Yeah, I saw that as well, but then it doesn't really relate to another project, I thought.
So I'm going to say this: we're certainly, we want to capture that information, right? I think it's right now, and that's part of why I had to, ask for community engagement, is that we need people to know about this. So the data just simply hasn't come in yet, but we certainly do not want to exclude anyone for any reason.
Hi, can you all hear me? Okay.
Yes.
Thank you for this. This is a fantastic, fantastic addition, I think. But just in terms of reaching out, and this is a follow-up to the last question, there have to be people clearly looking at human rights and a whole host of other issues around COVID-19. What is your method of actually reaching out to gather this information? Have you written directly to the various departments and had, sort of department chairs write to faculty colleagues to ask what they may or may not be working on? What is your outreach within the Columbia community to gather this information?
So the way that we disseminated this is that instead of having an email that's sent to every single faculty member, we decided to disseminate this through all the deans, who then disseminated to the department chairs, who then told their faculty, right? So theoretically, I think every faculty member at this point should have gotten an email about this, if not repeated emails about this particular survey. Now, if there are people who have not gotten those emails, we do apologize for that, and we want to know about it, right? Like, we want to identify people who have not heard from us. So, hopefully that answers your question. And again, we really do want to hear from people who haven't heard about this.
Okay, I just noticed that. I mean, again, I think it's fantastic, but it seems to be largely folks who are in the biomedical, sort of the uptown side of this as opposed to the downtown side of this. And I was just wondering about ways that we might possibly get more people to participate.
Yeah, for sure. So we know that there are entries there from the law school, the business school, and School of Social Work, just as schools, right? So we know that a lot of these people have, so every single school, should have gotten an email about this. One of their deans should have gotten an email about this, and all their department chairs should have gotten an email about this. So, we are really not trying to exclude anyone. When we do have representation from these other places, and we would love more representation.
Okay. All right. Well, I was just, don't take it the wrong way. This was not in any way suggesting that you all were making any errors. It's just trying to figure out how we can get more people to participate.
Yeah, for sure. If you have any ideas, please do contact me. Yeah.
Okay. Thank you.
I do have a question, if that's okay. Are you planning to connect this to any kind of data hub? I mean, this is really useful in order to kind of, but it still will get to this, like, one-on-one collaborative kind of approach after you've identified somebody. But is there a plan to kind of have a centralized database for the information gathered through those studies?
Oh, so you mean like a central data hub for data hubs, like, all the data that people are collecting?
Meaning for each, so one of the things in your presentation that that struck me was this idea that a lot of people are going to have repeated questionnaires being sent to them by various researchers doing various things. Is there some sort of plan that either within your group or that you know of to actually have some sort of repository of, for example, who's been approached in New York City?
There's none to my knowledge, but obviously that doesn't mean it does not exist. But it's an interesting idea, and maybe it does fit within the scope of what we're trying to do here. So I'll definitely raise it to sort of consider for, to be planned in the future and see what we think. Thank you.